Yeah, well, welcome to the February meeting of the North Andover Council on Aging. We've done the roll call and we have a quorum. I need to read, as usual, the governor's notice about virtual meetings, so I'll do that. Governor Baker has suspended certain provisions of the open meeting law and has imposed a strict limitation on the number of people that may gather in one place. Because of that, this meeting of the North Andover Council on Aging will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with the right and or requirement to attend this meeting can be found on the town's website at www.northandoverma.gov. Members of the public who wish to watch the meeting may do so on their television by turning to CAMED, which is Comcast Channel 99 or Verizon 28, or online. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of North Andover website an audio recording, transcript, or other comprehensive records of proceedings as soon as possible after the meeting. If the public would like to participate in public hearings, please email your questions or comments prior to or during the meeting to IOBrien, IOBRIEN, at northandoverma.gov. The question or comment will be read during the proceedings and responded to accordingly. So that's our preamble, if you will. And I guess we can begin. I think I saw Quintera appear, so we can add Quintera Costa to the attendance. Jack Graham, have you arrived? No, so I think Jack is not here. Everybody hearing me?
Yes.
Okay. I just heard the cam guy said he put everybody on mute, but I didn't get muted. So still trying to learn how this technology works or doesn't work, but we're all here. So first item on the agenda was approval of minutes. I think you've all gotten the minutes. Did anybody have any comments or questions or corrections regarding what appeared or didn't appear in the minutes?
No.
Larry,
Yeah.
Larry, this is Kama. I just want to compliment Tracy. For
Yes.
somebody who wasn't at the meeting, I felt your minutes were incredibly thorough, and
Oh,
it
yeah.
gave me a good sense of what was discussed. So thank you.
Yes.
Good.
Same here, Tracy. You always do great, accurate minutes.
I'm thinking we probably don't need to do like an individual roll call. So just say, all in favor of the minutes, just say aye.
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 Any opposed? Well, with no opposition, the minutes are unanimously passed.
Larry?
Yes?
Hi, it's Dee. Sorry. With these, you do have to do individual roll call votes because we're audio.
Yeah, but nobody said no.
Yes, you need to call on each member individually and they say yes.
Yeah, I understand what a roll call is. It just seems awfully stupid. But there's no shortage of stupidity in a lot of places. Okay, let's go ahead with your bureaucratic issues.
That's right.
Okay, Dave Van Arsdale,
Yes.
Joe McCarthy,
Yes.
Maria Rosati,
Yes.
Patricia Riley,
Yes.
Quintira Costa,
Here.
Jennifer Abu Ezi,
Yes. Yes.
Yes.
Tracy Shea.
Yes.
Okay. There's the yeses. There were no nos. So I guess now we can go on with the meeting. First item on the agenda is Quintira Costa on the update on the tax abatement project.
Hi. So I've been able to speak with the assessor's office, and they're very amicable on moving this forward, which is great. And they like the idea, and I believe it was Dave that joined me on one of the meetings. And so they're looking at maybe tapping into some other templates from other assessor's office who have maybe already done a similar project. I guess there's like a shared network on this. Like a way to gather facts on like the town and community. So they're working on that, and he even pinged me just like last week saying he hasn't forgotten, he's moving it forward, and he's just figuring out who's already using what, and once he has an answer, that will be all done for us, and he'll present it to us. And to the extent he can't find a template, he's perfectly fine having the new IT guy build something special for us. So it won't stall in its tracks if there isn't something that already exists.
Okay, good. Anybody have any questions, thoughts on that? Okay, thank you, Quintera. Next, we have kind of senior center update. One thing I'd like to mention just as we begin this, I can remember back years ago before retiring, so this is probably 15 years ago, one of the things that really changed in organization management internationally, because we were in a society that was becoming much more of a knowledge society, and there was a lot of concerns about information and what people knew or didn't know. So there was a movement creating within organizations a process around knowledge management. I'm not sure where that is. I've been out of the workforce for a number of years now, but I sit here now just during this pandemic, and we're all sort of isolated, and we're all trying to do our job. What does it mean to be on the Council of Aging, and what does it mean to be working, listening to staff and others and finding out what's going on. And a lot of times I'm kind of feeling in a cave, and do I really know what I need to know? And I don't know whether you all feel the same way or not, but we may take some time over the next several months. We're coming on a year now where we're in the COVID-19 lockdown, and we all may be making assumptions about what we know or what we don't know or what we need to know. I'm kind of thinking it might be helpful if we paid a little bit of attention and started talking about, do we all feel like we have the knowledge we'd like to have to be effective at what we're doing? Do we need more of a communications protocol, and what would that be? What might the town expect from us? What do we expect from the town? We're just not having that dialogue, and it's understandable. But I would like to find out what everyone else thinks. Do you feel like you know what you need to know to be effective as a council member, and for us to be effective as a council as a whole? I'm just going to leave that there and let you think about it, and we can come back to that at another time if you wish, or you could just email me or telephone and we can talk about it. But anyway, to have the senior center happening and kind of get an update, I think Carla is going to do that this day. Is that true?
Yes, that's me.
Okay, Carla, you're on.
So I think at the last meeting, Irene indicated that the budgets were due, and we had submitted our elder services goals for 2021. And in one of those goals, it said to form initial internal teams in organizing and purging items that will no longer be of service or needed at the new building. I had told Irene that I'd be willing to take up the charge and oversee this. And pretty much the start of January, I put together the teams and have given them direction and instruction as to the areas that we need to purge. We have not entered into any purging of paper. I'm going to consult with the clerk's office to just make sure that we're doing whatever it is that we're supposed to be doing in terms of documents and so forth. But mostly we've been concentrating on and it's a very, high-end term. It's called stuff that we have collected over, like God knows, probably 18, 20 years. And we started with what was the attic space. Some of you may not even know that the senior center has an attic, but we do. And it was chock-a-block full with old Christmas decorations, holiday decorations. So the custodian was able to get it down onto tables. It's been really nice not to have other bodies in the building so that we can sort of spread out to go through this stuff. So we have accomplished the attic space. We've accomplished 3 closets. We have working on the back living room and the closets and storage in those areas. And this is pretty much how the work has been delegated to the part-time staff when they come in for their designated, say, 4 hours a week. So I'm feeling that that is moving in the right direction, and I have a goal set in my head that we need to get it done before then we start introducing people back into the building. So whenever that ends up being, that we're being given permission to do that, I'd like to know that at least this initial phase has gotten underway, and we have to come up with a mantra so that we don't collect it again. The Meals on Wheels program, of which we have in our building, they are not something we run, it's run for services. They have had a little bit of a shakeup. The North Andover site coordinator has had a medical emergency, and so therefore she has not been able to be here. Put in a temporary person to oversee the role that she played, and she has started as of this week. However, she's waiting for her paperwork to go through in order for her to be here every day. They are also struggling with getting volunteer drivers. So at this juncture, 3 days of the 5-day week, 2 of the drivers have to share a second route. So of the 4 routes, 2 of those routes have to be covered. So it's been a little bit of a challenge for the Meals on Wheels program. And being that they are in this space, the senior center tries to be as supportive as possible without interfering and getting involved. In the clearing of one of the closets, we had very large tubs of knitted hats and scarves that the knitting group that was meeting regularly and has for many years. So their mission is to create these hats and scarves. Initially, it was to provide them to veterans in the valley. We kind of narrowed that mission or vision down to supplying the elementary schools with hats and scarves. So last year we missed the window in distributing those things, and so we had pretty much quite a bit of them, and so we brought them down, we sorted them, we put them all in plastic sleeves and labeled them small, medium, and large. And then last week, working towards that goal, I had connected with one of the school nurses, and she told me which elementary schools she felt were probably in the greatest need. And so 187 pieces, total. between hats and scarves were distributed to the 3 elementary schools within the town. So the part-timers were really facilitated in that in terms of wrapping them individually. And I think going forward, when we get back to our knitting group, that we'll make sure that that step is done at the time when they submit their hat, so that we're not handling the hats more than we really need to be. The brown bag program, because it was supposed to happen last Tuesday, which was a snowstorm, it got canceled. I got an email yesterday that they have rescheduled the February distribution for Monday, the 22nd. And then the following week, which would be the March distribution, they're going to do it again. So our brown bag recipients will receive a bag of groceries 2 weeks in a row. And then probably the latest thing would be that the governor has allowed 40% occupancy in the building. And so Dee and I have been chatting about how we can get our staff or our team members back into the building in their offices, at their computers, more than what they have been able to be at this time. So that's kind of my synopsis of what's kind of gone on for the month of January. Any questions?
How about food distribution?
The food distribution, Dave, has sort of waned. We were initially allowing people to come to the door and request groceries, but in kind of doing a mini survey, we found out that several of those persons were not North Andover residents.
Oh.
And even though we didn't ask for identification, we just kind of took a poll, and the percentage was that they did not live in town. And it was decided that those in town that were making that donation did it in good conscience, that we were giving it to North Andover residents in need. So we kind of shifted and asked that if there was somebody, we've stopped giving it out at quote the door, and had requested that people phone the senior center and make an appointment to pick up food. And that way not force the staff to be ready at will, that we could set like a parameter around appointment times. But the reality is no one has called to make those appointments. It's not like if somebody comes to the door, we refuse them, but it has become less and less of a formalized program. The donations from the town have also dwindled. So, and if you were to visually see what's here, there is quite a bit of inventory. And I think for us right now, it's figuring out how to move it out and move it forward.
Any other questions or comments anyone would like to make?
I have a question on the organizing and purging. Is there anything that the building committee can do to help on that?
Yeah, that's a good question. I hadn't really considered that. If you wouldn't give me some time to put some thought to it, I could certainly reach out to you and let you know.
Thank you.
Okay, thank you. Any other questions? I guess I do have kind of an information question. Maybe the only one who probably even has a remote chance of answering it would be Dee. And that's, I go to a dentist that's next door to town hall that I've been going to for a long time. And when I was in there, the dentist mentioned that he was not allowed to reopen until he changed his ventilation system to provide some filtering and cleansing of the air. And now when the town starts talking about opening up and going to 40% and increasing, is there anything the town is doing to air condition their own buildings or vent them or air them or cleanse them or whatever?
Yes.
That's a quick answer. So the town is doing something to kind of clean the air?
That is correct, yes.
Okay, good. Thank you, Carla. I appreciate you doing the report. It certainly looks like a lot of stuff is happening in the senior area, even though we're kind of shut down. Next on the agenda is an update on the health coronavirus and vaccines. Joe McCarthy.
Yeah, before I go there, I do have a question for Dee. Where do we stand with acquiring the final parcel of land needed for our new senior center?
Thank you, Joe. I was waiting to be recognized to give an update on the status of the construction, so let me pull up my notes. So the tenant of the current owner of the Sutton Street property is still living there. The owner continues to ensure the town that he will vacate within a couple of weeks, but we have been hearing that for a while now. The town and Minko Co. have exchanged drafts of the purchase and sale agreement for the parcel that the town will purchase. We're still awaiting feedback from Minko as to whether they will sign the PNS or if further revisions are required. Now, once those two issues are resolved, the town can provide a notice to proceed to its contractor with the abatement and demolition of the existing structures. So our fingers are crossed for hopefully a start in March.
Oh, thank you, Dee. Also, to Larry, you mentioned earlier, and you sent me information on regarding what you just talked about, knowledge base and so forth. When I first became a member of Council on Aging, which is many years ago, I went to a training program focused to help these new members understand more about our Council on Agings. And it was very good because of the pandemic. I don't believe that has happened for the better part of a year or so, but hopefully going forward, that will be available again. Dee or Irene, if she's still here, can you comment on that?
Good morning, everybody. Yes, they are still running the trainings for board members. I believe that all our current board members have been to the training, if I'm not mistaken. I know Larry, I remember Larry going, but they did not do one last year because of the pandemic. And I think that's something that will happen when everything's lifted, where Emmett would come up from Boston and he would discuss all the different aspects of being a board member. So yes, I believe that. Has everyone on the board been to those meetings? I believe they have. I'm not sure about Quintara, but.
I have not. This is Jen.
Oh, Dave.
Jen, okay.
And I don't think Joe Nahill being the newest member.
Right, the absence, right.
I
So
know
they
I
do it
did
once a year.
online training. I don't know that I was able to go to an in-person training, but then, and also somebody I thought came to one of our meetings for a training or a seminar or something like that. But there was an evening one that I didn't attend, but not everybody attended. It was just like Joe Sergey went to up at the library. I think someone from the board had to attend.
Yes.
Oh no, I went to that. That wasn't what she's thinking training.
Okay, yeah, that's the only one I know I didn't go to.
Yeah, Emmett came to the senior center, Emmett Schmarazzo, and gave a presentation to the board because a lot of the members couldn't make the original training session. And I'm not sure how they're moving forward with that towards the coming year, so we'll see. It's usually in the spring.
And that training program was very good. Okay,
Dave, did you have
on.
a question? No. Okay.
Okay,
I thought I saw
moving on.
Dave raising his hand. Okay, Joe, I guess you can go on.
Yeah, moving on to a health and safety update. Focus, of course, on the coronavirus and the vaccinations. Finally, there's been some recent improvements in the COVID-19 data with cases, hospitalizations, and deaths and positive rates all trending down. And as of yesterday, as mentioned a few moments ago by Carla, the Baker administration has increased temporary capacity limits from 25 to 40%. Now that increases for various businesses, such as restaurants, stores, gyms, and offices too. Now, the reason why these improvements in COVID-19 data has been noted is occurring. A reason such as more PPE has become available. People are doing a better job following the guidelines of wearing masks, maintaining social distance, and sanitizing their hands. Almost 40 million Americans, which is approximately 12% of our population, have been confirmed to have caught the virus. And in that, many people don't even know if they caught the virus. The actual number of positive cases in the US, I read it could be up to 100 million, which is almost a third of our population. Furthermore, about 35 million vaccine shots have already been given in the United States, and that is up from 6 million vaccine shots, as I mentioned last month during a Council on Aging meeting. So as such, up to 40% of the US population has already had the virus or been vaccinated against the virus. And when this number reaches at least 70%, probably closer to 80%, herding takes effect and the virus will die out, hopefully. But there is concern with this new strain. They say that within a couple of weeks, this new strain will be more prominent than the older strain. So that is a major concern, to say the least. It appears that the vaccines are good for the new strain too, but as the strains change, who knows what's going to happen. Nor do we know how long these vaccines will be effective. We may need a booster shot, perhaps on an annual basis. Consider the vaccines in addition to authorized Pfizer and Moderna vaccines. Johnson & Johnson has requested emergency use authorization for their one-shot vaccine, and authorization is imminent. So the highlights of the North Andover virus statistics, and this highlight is from February the 1st. The numbers have since gone down, but the total cases in North Andover are 2,341, active 128. That has gone down markedly over the last few days. Last month was 250 active at this time, and recovered and out of isolation is 2,135 people in our town. Related deaths, 81, and that's up from 69 last month. But the positivity rate continues to increase. That is the percentage of people that are tested, how many of them actually have the virus, and that's below 3% right now. Last month was, at this time was at least 6%, if not considerably higher than that. Now, the Massachusetts priorities to receive the vaccine, which do remain in short supply, phase 1, clinical providers, patients in nursing homes over 65, first responders. Phase 2 is what most of us are interested in, and that is from February the 1st to March the 31st, a projected end date of March the 31st. And that's people over 75 years of age. They are being vaccinated right now. Age 65 or over, or with 2 comorbidities. That is 2 major reasons that could cause their death. That probably will happen within a couple of weeks. There's so much we really don't know, but conjecture probably happened within a couple of weeks. Then we go to early education, K-12 workers, et cetera, et cetera, et cetera. Then finally, in phase 2, people with 1 comorbidity issue, regardless of their age. And phase 3, that is the general public after March the 31st. Now, Massachusetts seniors and the vaccine, and this is the focus for this last part of this presentation here. Seniors in nursing homes and assisted living communities who have wanted to be vaccinated, most of them have been vaccinated. As of February the 1st, seniors over 75 have been eligible for vaccination. However, signing up on the MassGov website has been difficult for many seniors, 40% of whom don't even have Wi-Fi access. So the state and our town are now helping them sign up. For state assistance, dial 211. I repeat, for state assistance, just dial 211 and they'll help you sign up to be vaccinated. The state call center will have more than 500 workers available to help eligible seniors book appointments. I read an article in today's Boston Globe. Governor Baker said that there'll be slots available probably at the end of next week, end of this week, excuse me, for vaccination. So we will see about that. On town assistance, I made verbal and written suggestions to town employees, including our town manager, on specific ways of helping our town seniors sign up. However, simultaneously, there was a town task force that had looked at ways of helping our seniors and has finalized what they're doing. For town assistance, dial 978-208-6070. That is 978-208-6070. And I'm saying that more than once because I know some people are listening into this meeting right now. Furthermore, our town has been reaching out to eligible seniors. This is a major undertaking, and I'm very, very impressed with what our town has done. They've been reaching out to eligible seniors, such as phone calls, postcards, etc., etc. Dee or Irene, because both of you have more information than I do, would you like to further elaborate on that? Dee, Irene, can you further elaborate on what our town is doing to help our seniors?
Hi, good morning again. Yes, the town has really stepped up and has a lot of the town employees calling seniors. They made a spreadsheet, and one of the recommendations was to send postcards out. I believe they went out on Monday or Friday. I'm not sure what day, to seniors that weren't answering the phones. We have a lot of information going out there on the 211 information. We've been posting it on our social network. I think that the town has been just amazing on what they have provided to the community. It's very difficult because you realize that a lot of people won't answer the phone because they don't recognize the number. We've ran the information on CAM, to hopefully that folks will see that and understand what they need to do to be vaccinated. I know that they've been doing Meals on Wheels drivers, I believe, have all been vaccinated by our Board of Health because they've had an extra vaccine left, and they've been calling in people as they do when they did all the first responders to come in and get the shot by the list that the Board of Health has created.
In addition, with that database, we're reaching out to all seniors over 75 and getting the status as to whether or not they have access to get the vaccine at a location or if they're homebound. So we're having staff record all of that data and hook up people with the site at Danvers or Lawrence General Hospital. We're also going to be holding local clinics, although as Joe knows, the local clinics will take more time because we're only going to get about 100 doses a week. And also some local pharmacies will be giving shots. But again, we do not know the date or the location, but as soon as we do, we will get that information out to seniors.
So if confused, if you're 75 years of age or older, and you are confused, again, the two numbers are called, state 211 and town 978-208-6070. Also, speak with your primary care physician. Our president says that within the first 100 days of his administration, there'll be over 100 million doses available. We will see things are getting better. They are getting much, much better real fast, but we still have a long ways to go. Now, for seniors over 65 who will be eligible, hopefully within a couple of weeks, to be vaccinated. So by the end of March or April, most seniors in our town who want to be vaccinated will be vaccinated. So as such, a major topic of town that is our board discussion, soon will be when can and how will our senior center safely reopen? We all agree on primarily one thing, that will happen when it's safe to do. We just don't know when. Nor do we know if that's going to be our decision. It may be the decision of Governor Baker. I don't know. But could it be late spring? Perhaps. Probably later than that. Could be as late as the fall. Don't know. Irene and I talked a little bit about it yesterday. We're certainly talking the same language. And if you have further comments on that, Irene or Dee, would be much appreciated because it concerns our seniors. And our senior center is an umbilical cord to reality and normalcy for so many of our housebound seniors. Irene, Dee,
Yes,
further comment?
I actually have a couple of comments. I was on a NEAT, Northern Essex Elder Transport call yesterday. We have, through the NEAT program, 25 volunteers available that are willing to go to Gillette, Boston, the the hotel down in Danvers, and they're willing to take a senior to that. What someone would have to do is to reach out to the NEAT program by calling Paula here at the senior center, and she will get in touch with Ginny, who is the director of the NEAT program, and set that appointment up for someone. So they're very willing to do this, to take people as far as they need to go to get the appointment. And NEAT is not charging for the transportation at this time. So there is no donation necessary. But again, it would be up to the client to set up the appointment, let NEAT know, and if there is a driver available, they will certainly take care of that. On opening the new senior center, the staff and myself have been working on, actually we just started, we did a layout, and we're looking at classes that we could possibly bring back in on a very smaller scale. But at this point in time, we need to see how people are vaccinated, how we will double check that. Is it legal for us to ask people to show a card that they've had a vaccination? So there's a lot of parameters to that. The other thing is the senior center has to be made ready to invite people back into the building with plexiglass and a complete cleaning of everything. And we do have 3 very large rooms. We were thinking of trying to maybe do an invitation and invite maybe 5 to 8 people in for like a lecture series and have it be taped so that other people could watch it on the cam. The exercise programs are very difficult. We have talked to actually all our teachers. Leah has pursued information with them, and they want to be paid. If we show a 6-week class 10 times, every time that's viewed, they want to be paid their $50 for their classes. And we don't have any income coming in that pays our teachers to do that. So that has been a difficult step for us. But we've really looked at a lot of different avenues of what we can do and how we can do it safely. But that is going to be up to what's happening in the climate at this point in time, whether it be the spring, the fall, the summer. We want folks back in the building. We thought of maybe just having the congregate meal and see, because that room is certainly big enough to hold 8 people social distancing. But again, what are the parameters that are necessary to have in place to do that? And we are looking at it. And I also challenge the board to think about it and think, how would you do it? And come back to me with some information. We'd greatly appreciate that. The other comment I wanted to make was last night, the Board of Selectmen, Melissa Rodriguez and Dee Casey, presented the new budget. They did an amazing presentation of the budget. It was very precise, it was very understandable, and the visual of it, I had looked online and looked at the book that came out, and it was really very, very nicely done. And Lynn Savage did an amazing job. I know how difficult that is to do something like that. So thank you for that. That's all I have to say on that.
Yeah, I also, I watched last night's select board meeting, and at the very end, Brian LaGrasse, he's the director of our Board of Health, Department of Health, excuse me, he gave a virus and vaccine update at the meeting. It was very good. He's very, very good. And he went over the specifics in even more detail, what our town is doing. So there was a lot of information out there to seniors. Our meeting, our Board of Health meeting, the select board meeting, the news media, our town website, phone calls, postcards, and so on and so forth. And for those seniors that are 75 years of age or older that are computer literate, and obviously we know many of them, at least some of them, making an appointment on the MassGov website is very, very easy. I don't care what you read. It's easy. I've been there. I've gone through it with a number of seniors 75 years of age or older. Getting an appointment is difficult, but going through the steps to get an appointment is easy. You just may not get an appointment as expeditiously as what you'd like. So on the MassGov website, you note your eligibility, you know where you would like to be vaccinated. There's a big vaccination clinic, by the way, at Lawrence General Hospital. It's 1,000 people a day, and I've heard that it's very, very efficient. And by the way, when you leave, be sure you have a date to be re-vaccinated. If you get a vaccine from the Pfizer shot, you have to wait 3 weeks before you get your second vaccine. If it's the Moderna shot, it's 4 weeks. The new Johnson & Johnson, that may be approved as early as this week, is only one vaccine. So there's a lot of information out there for our seniors, regardless of their age. And I hope to have and present more information on vaccine availability and shot locations by the next Board of Health meeting, which will be Thursday, February the 25th. And by the way, any of these meetings, like this meeting here, I believe they are repeated at least 4 times a month at different times on a Council on Aging meeting would be, for example, Comcast Channel 99. And our Board of Health meeting is typically channel 8 on Comcast. Verizon's is a different channel. So that's it. Are there any questions at all? Because this is getting to be a pretty exciting time. The light is definitely at the end of the tunnel. We can see it. I just don't know when we're going to be there.
Joe, can you repeat the North Andover number again, please?
Absolutely. 978-208-6070.
Thank you so much. Thank you, Joe.
And the state number, just pick up your phone and dial 211. And that's it. And they'll help you. Our town will help you. Our town is doing a lot. And the state will help too. So things are getting easier.
Joe, this is Jen. You hear me?
Yeah, I can hear you.
Okay, I went yesterday to the Lawrence vaccination site to get my first vaccine. I was phase 1 and never could get an appointment till now. I must say I waited an hour and 15 minutes in line standing. So if anyone is going, make sure that they eat before they go, because you'll be standing up. Make sure you have your assistive devices with you, cane, walker, wheelchair, and make sure you use the bathroom before you go in.
Red, goes, white, red, goes.
Yeah, and also too, you have to sign a form, which you can do online, and the form is why you feel you're eligible, your name, your address, your age. If you have, I don't believe they ask for Social Security. If you have an email, fine. They would like to have that phone number, fine. And then you sign it, you date it, and that's it. So it's very easy if you know your way around. If not, it's a daunting undertaking.
Dave, you have a question?
Yes,
Comment?
as president of Edgewood and a large congregate living facility, we had previously been under contract with one of our pharmacies to do our COVID shots, and they were being very reticent about getting on with it. And the management approached the local Board of Health, and they were wonderful. And they helped supply the Moderna vaccine. And last Thursday, 98% of the independent residents at Edgewood were given their first shot.
That's an amazingly high number, very impressive, because I have read that up to 40% of people don't want to be vaccinated, at least at this particular time. So wow, that's terrific. 98%.
Yeah, we have 98%.
Wow.
They're having some issues staffing who listen to too much social media, but now all the assisted living and healthcare centers have been fully inoculated with both shots. But now the independent residents have their first shot and a scheduled date for the second one.
And incidentally, when you get your second shot, actually, when you get your shots, period, it is not your decision as to what you get. You get what is available.
That's right.
If it's the Pfizer shot, that's what you get. And the second shot will be Pfizer. It's the Moderna shot, that's what you get. And the second shot will be Moderna.
Well, the independent people got the Moderna, but the rest of the healthcare people actually got the Pfizer one. So we'll compare results 3 months from now.
Well, the comparison looks good because they say the efficacy of both these vaccines is 95%. Yeah. Now, which means that there's a concern with 5% of the population, but that concern is okay. They can still catch the catch the virus, but they will not be sick. And well, I don't know of any deaths at all. Although it's too early to say what will happen if you are in that 5%. But it looks like
the biggest thing for us is that we're in a congregate setting where, you know, if somebody gets it, the next person's not very far away.
Yeah.
And so it's good to get us all on the road to vaccine just for our own self-protection.
And once you get even one shot, your protection is in excess of 50%.
That's right.
Now the Johnson & Johnson shot, and again, that'll be a single shot, not a double shot. The efficacy rate is not as high. It's about 72%. However, after 3 months or so, it goes up to like 85%. And there may be a booster shot for any of these vaccines. We don't know at this particular time. And so even at 85%, that means 15% of the populace can be infected. But the infection is very, very mild, maybe like a bad cold or flu. And there's been no deaths noted to date. So good news, good information.
Yeah. Thank you, Joe. Thank you all.
Thank you, Joe. Thank you.
When I look at the agenda, those were all of the items that I had received prior to the meeting. Does anyone else have any other business they'd like to bring up? Not hearing anything, I suppose we come to the adjournment. I don't know if that requires a roll call vote. Does it? Dee? Do we need a roll call vote to adjourn?
I'm here to advise the committee on best practices. The committee can do what it wants.
That's helpful.
That's encouraging. Oh,
Terrific,
boy.
Isn't it?
So I'll make a
Okay.
motion that we adjourn.
I know Joe
Okay.
knows the answer is yes, right, Joe?
Joe McCarthy makes the motion, we adjourn. Is there
I'll
a
second it. I'll second it, Maria.
Maria is the second. Did somebody say yes, we have to do a roll call? Then I'll just call for a voice. All in favor?
Aye.
Aye.
Any opposed? There are none opposed. So thank you all for coming. I think we had a good meeting today.